So the Republican push to repeal and replace Obamacare is on hold as Senator John McCain, who had expressed reservations about the bill, well, he's recovering from surgery to remove a blood clot above his eye. The senator's office says doctors ordered him to stay home for a week, but could his condition be more serious than we know? CNN chief medical correspondent Dr. Sanjay Gupta joins us now. And Sanjay, how serious is this? As an eyebrow incision, it sounds small, but is that the case?
Yeah, I think it really was sounding small the way that it was described initially, an eyebrow incision to take out a blood clot. What the hospital released on Friday, to give a little bit more definition to what happened here, it was an eyebrow incision, which typically is done to try and hide the scar. But after that, it was the skin was open, and then actually the bone underneath there, you can feel the bone right underneath your eyebrow, was also opened. That's called a craniotomy, and that's to basically gain access to the brain. Let me just show you quickly here. I have a model. This is a model of the skull. It was over the left eye there, so it was in this area. And again, this bone was removed to basically get access to the brain. And you can see, this is the frontal lobe of the brain. It would be in this area right around here that they'd actually be able to gain access. It's a significant operation. Anytime you're basically opening the bone to gain access to the brain, it's a significant operation, requires general anesthesia. There was obviously an abnormality there that was concerning enough for him to go through this, for the doctors to recommend that. So we don't know for sure. I'm not sure the final results have come back yet, but not an insignificant operation by any means.
Sanjay, how do you think they figured out that he had a blood clot behind his eye? And I just want to remind people, remember there was that moment during the Comey hearing where Senator McCain seemed to be sort of way off message and confused. Let's just remind people of this moment.
That investigation was going on. This investigation is going on. You reach separate conclusions.
No, that one was done.
You're going to have to help me out here. In other words, we're complete. The investigation of anything that former Secretary Clinton had to do with the campaign is over, and we don't have to worry about it anymore?
With respect to Secretary, I'm a little confused, Senator.
Okay, so is there some sort of connection that you as a doctor would draw between his condition and that moment?
It's tough to draw a cause and effect there. When someone has a pressure on the frontal lobe of the brain, there can be all sorts of things. Typically, people may have headache. Sometimes they can develop some weakness on the other side. It can affect your judgment, but it's hard to say. I will tell you that they say that the abnormality, I'm going to call it an abnormality versus a blood clot, because we still don't know for sure what this is. It was about 5 centimeters in size, which again is pretty sizable. If you sort of think about the brain, and this is not obviously an exact replica, but it's a pretty significant size there of compression, if you will, on that part of the brain. What is concerning, I think, a little bit is that he has a pretty significant history of melanoma, including melanoma in his left temple, this area right here, that was invasive. That was back in 2000. As a result of that, you usually have frequent screenings to make sure, look, is there any evidence of spread? Is there any concern here? What the hospital said is that this was found on a routine scan. So it didn't make it sound like he went in for a particular reason, but it was a planned routine scan for follow-up, and most likely because of the melanoma.
Sanjay, they say 1 week. Does that sound like enough time to recover to you?
It sounds a little short. I'll be honest. Again, I would not minimize this operation. People can recover quickly. He's 80 years old. This is a pretty big operation. If it were one of my patients, you'd say at least a couple of weeks typically before you'd have the person sort of, back to their regular activities of daily living.
Okay, Sanjay, thank you very much for explaining all of this. Obviously, we're thinking of Senator McCain and wishing him the best right now.